An American Sickness. That is a book you should read, but if you don't, we already have. Hi, everyone. John Daly here, along with Judd Anglin on the Healthcare Secrets podcast. Now, we assume you don't rush out to get the latest book about our broken healthcare system, so we do it for you. From time to time, we'll break them down, and we'll fill you in on the secrets you should know. Now, this is one of the best about the worst of the healthcare industry. It's called An American Sickness by Elisabeth Rosenthal. And Judd, we both read this. We have both seen exactly what she's talking about. The American people are being hoodwinked and scammed by the healthcare industry. Now, that doesn't mean all the people in the healthcare industry are evil, but it certainly means they are stuck in a system that is working purely for profits and not for yours and my healthcare outcomes, right?
Spot on, John. I've read a lot of books about our healthcare system. I had to for my medical tourism business, understanding the transformations and healthcare reform and all that. But I have to say, Elisabeth, I think she's done the best job of really describing how messed up our system is.
Yeah, I would agree. I would agree with it. Now, this was released in 2017. It's a real shocker about what goes on behind the healthcare industry's closed doors. Now, she lays out the economic rules of the dysfunctional medical market. And although there are 10 rules, just for brevity's sake, we're going to discuss about 3 of them here. I'll mention 2 others later, but let's go through them. So, Judd, let's talk about the first one. Number 1, more treatment is always better. Default to the most expensive one. Now, my interpretation, some people will say this is, because of malpractice suits. What do you think?
Well, the malpractice suits is partly true. It's certainly a contributing factor. But I think the healthcare system is exactly the way it's been designed to function, or the way it's designed to function. Really, collusion between big business and big government. And they've set it up to totally maximize profits every step of the way. And they've done a magnificent job of it. If you look at all the big corporations, all the big insurance companies, medical device companies, pharmaceuticals, their stock market valuation is through the roof with no end in sight. Any legislation that tries to begin in Congress or with the president gets shot down so quickly because they can afford billions of dollars on lobbying.
And then on top of it, they also they know how to allow the mergers and acquisitions to happen, so they consolidate. And they keep telling everybody, this is to save cost. No, it's to reduce supply and demand so prices go up. So it all ties in. I think it all ties into the fact that there's heavy lobbying going on. There's the amount of money that goes into politics that allows them to control a lot of the politicians. And that's exactly what we're seeing. All right, let's go to the second rule of the dysfunctional medical market, as Elisabeth Rosenthal says. A lifetime of treatment is preferable to a cure. Now, in the book, she documents a researcher at Harvard Medical School who believed she was only steps away from curing diabetes, and yet no pharmaceutical company or nonprofit would step forward to fund her research, including the Juvenile Diabetes Association. This was one of the things when I read this book, I had to almost stop reading the book. I was so angry.
But here's the thing, John. That happens all the time. Now think about this. You have to chew on this and just digest this for a minute. But they never talk about curing a disease. What they refer to, or how they call it, is management. They want to manage your disease with the symptoms. So you come in, you have a pain in your stomach. They don't know what it is, right? They have to do maybe MRIs, do all these studies. And when they find that, what they want to do is treat that symptom. They don't want to find how that symptom occurred and cure it. They want to manage it. So they give you drugs. And when they give you those drugs, guess what? Very toxic to other parts of your body, other organs. That means as you treat that symptom, you're going to be back in shortly for another symptom somewhere else, probably as a result of the drug. But they're not interested in curing it.
Nope. It doesn't bring as much profit. If you're well, you're not going to see them. You're not going to be putting money in their pockets. Yeah, it's unbelievable. You're listening to the Healthcare Secrets podcast. I'm John Daly, along with Judd Anglin. You can check out Judd's book. It's called The Big Book of Healthcare Secrets. It is at our website, which is healthcaresecretspodcast.com. We are discussing a great book here called An American Sickness by Elisabeth Rosenthal. And now and we've given you 3 of the 10 takeaways of a dysfunctional market. Let's give you we've given you 2 already. Let's talk about the third one here. Amenities and marketing matter more than good care. And as much as I can't say I notice that all the time, but I certainly think it's out there.
Yep, you're absolutely right. It is out there. And that's one of the things that I got from Elizabeth's book. And that was most of the big hospitals, like across the country, are nonprofits, right? They're not supposed to be profitable. But the funny thing is, if you go to any of these big hospitals in any city, they're the most profitable organizations or businesses in that town. Now, the way they manage their finances is to not show a profit. They spend hundreds of millions of dollars on marketing and like really frivolous things that have nothing to do with care. For example, she talks about one hospital that buys, I believe, artwork, paintings that cost $20 million to put up in the atrium.
Wow. All right, let's hit just 4 and 5 just really briefly. As technologies age, price can rise rather than fall, and that's just because you're not getting the better technologies to help people diagnose stuff or to get them exactly what they need. Isn't that about right?
Oh, that's absolutely right. I mean, hospitals spend millions of dollars on new technology that they don't use that often. A big one is the Da Vinci robotic system that they use, mostly for repairing, mitral valve of the heart. But I mean, those machines are so expensive.
Wow. Okay, let's talk about number 5. There's no free choice. So patients are stuck, and they're stuck buying American. Now, we should say that, American medical technology, isn't that bad, but at the same time, too, it's not as good as other nations, as you've talked about before, especially when we talk about medical tourism. Hit on that real briefly.
Yeah, that's a good point. You're not trapped because you can always, as long as it's an elective procedure, you can travel to anywhere in the world and have it done. You just want to make sure that you have the right information and you're going to the right place, as we discussed in the previous podcast. These hospitals are, they're procuring the same technology that American hospitals do. It's just a far lot less expensive than it is here in the U.S.
Okay. At the end of her book, and again, we're talking about An American Sickness by Elisabeth Rosenthal. Again, we urge you to go out and get it. At the end of the book, she has a number of solutions and websites you can go to reduce your costs that allows you to take a little bit more control of your healthcare. Let me give you what I think my biggest takeaway is, because I actually reviewed this book too. It comes from Dr. Wayne Dysinger, and he is an MD who is a direct primary care doctor who also teaches out at Loma Linda in California. Hopefully we're going to get him on the show. But in an interview I did with him a few years ago, he said to me, all the research shows that 90% of what ails us can be cured or controlled by lifestyle changes. That means exercise, diet, sleep, and stress. Now think about that. The majority of us don't really need the health care that's provided in America. Now hopefully we will have another doctor and another author on the show. He's Dr. William Davis. He's the author of the book called Undoctored, and he shows you how you can be healthy without a doctor. So the sad part about all this, to me, Judd, is, 90% of us, if we took care of ourselves and we actually reduced stress, we dieted, we exercised, we wouldn't have to deal with all this stuff.
Oh, that's so true. I mean, and that's part of the way that our healthcare system has been built up over the years is that we've outsourced everything to the experts. And with that, we've also outsourced, managing our own care. Insurance is paying the bill, so we don't think about it. But if you have to pay your own bill, and you're going to make sure that you're healthy, right? I mean, it becomes a big economic factor then. It's like the last thing I want to do is go to the hospital and pay for some sickness that I have because I didn't get up and, 30 minutes earlier and go for a walk or make better decisions on what I eat.
Yeah, and the sad part is there's a lot of people who think, oh, well, you know what, my employer is paying for it. I'm not paying for it. Technically, you are paying for it. Again, the book is called An American Sickness by Elisabeth Rosenthal. We would love to get her on the show as well. Judd, give me your biggest takeaway from her book that ties into your book.
Well, what I would say is, like I told you, she does a fantastic job laying out just what a mess our healthcare system and what a an industrial medical complex has built and just slammed on top of us. But one thing that I found about her book, it was very light on the solutions. And that's why I really think my book should be the companion or the final chapters of her book, because I give you, details of exactly what to do to lower your bill significantly. And we'll be talking about all of those as we continue our podcast. But you're going to be amazed by some of the solutions that you never hear from anywhere. Just to give you an idea, I've facilitated over 10,000 patients traveling abroad for surgical procedures. Now, in those years, I've had some very innovative customers that came to me with their own solutions that I was absolutely shocked by. I'm going to be sharing some of those. And I look forward to it because people will just be amazed of these little ideas that you can use to decrease your bill by sometimes 60 to 80%.
Yeah, and that's what's great about reading your book is that there are things that you can do as an individual. You don't need to go get permission from anybody. And one of the other things, too, another book hopefully we get a chance to discuss is called Bitter Pill by Stephen Brill, and that's also about the industry. And he really takes the industry apart. And his solutions are just, let's do more consolidation and let's let the hospitals do more. And I was like, okay, you covered the problem, you didn't cover the solutions. And I think in Elisabeth's book, she at least points you in the direction of certain things. So at the end of the book, you do get to see some things. But I would agree with you. I think yours provides a lot more insight to actual solutions that people can actually get their hands wrapped around. All right. Again, Judd's book is called The Big Book of Healthcare Secrets. You can get it on our website at healthcaresecretspodcast.com. You can also check us out on YouTube, Facebook, and Twitter. And tell us what you think. We're also going to be on a podcast site called Spreaker. So you can go to Spreaker.com. Give us your suggestions for future shows as well. And if you have any questions that we can help you with, including medical tourism, Judd's the expert. He can let you know. Judd, another great show. This is a lot of fun.
Enjoyed it, John. Thank you.
All right. Remember, folks, only you can make yourself healthy. We'll catch you next time on the Healthcare Secrets Podcast.